Hey guys, welcome back to the Wellness on Purpose podcast. It's your host, Marissa Laughlin here, and today we are featuring Cyrus from Pure Lab Vitamins to talk all about cardiovascular health. With February being Heart Health Month, we thought this was the perfect opportunity to bring awareness to cardiovascular disease and specifically to women with cardiovascular disease because this is a topic that is not talked about enough. Surprisingly, cardiovascular disease is the leading cause of death in women, and it's because signs and symptoms of cardiovascular disease tend to be overlooked by other health concerns and conditions. So without further ado, let's welcome leading compound pharmacist Cyrus from Pure Labs Vitamins, based in Ottawa. Hi, Cyrus. Welcome to the Wellness on Purpose podcast. Thank you so much for taking time out of your schedule to feature Pure Labs on our podcast and provide education and support to our community. Let's jump right into it. And how about you tell our listeners a little bit about yourself and Pure Labs Vitamins?
Yeah, so I've been a compounding pharmacist for half my life. I studied and practiced in Düsseldorf, Germany, and moved to Ottawa in the year 2000. Compounding, I always explain as the old craft of fabricating individualized prescriptions like creams, ointments, capsules, but also nasal sprays, and also sterile compounds like injectables, intravenous supplies, but also sterile eye drops or ear drop. My key interest in the field of compounding has always been chronic pain therapy, so-called bioidentical hormone replacement therapy, or BHRT, but also drug cessation. It's very rewarding to help people get off drugs, especially if they want to but can't really succeed. And by compounding very small incremented dosages, you can then help them get off these meds. In the later years, I'm more and more focused on orthomolecular therapy forms where we use nutrients like vitamins or minerals as comparable to drugs. We produce specific medicinal forms, sometimes in very high doses, to achieve true therapeutic turnarounds. One example here is intravenous application of vitamin C in a variety of very severe conditions, including the big C. Why this all started, I used to make these magnesium capsules manually in my compounding lab, Bioword Market in Ottawa. And very quickly, we were not able to meet the demand that this product really generated. So me and my friend Roger Biddle kind of decided to take this up a notch and started Pure Lab Vitamins with, at the time, just 2 products. And today we have 25 NPN licensed unique products in the Canadian market. I no longer practice as a pharmacist, and we're working mostly with independent retail stores, but also some naturopathic doctors, medical doctors, chiropractors, and a handful of assorted pharmacies in Canada.
Okay, so you arrived here in 2000, and when was Pure Labs Vitamins established as a company?
2010. We've been in business now in our 11th year. We're growing sharply every year, even though we really focus on quality of our service for retailers. We focus on more local presence. We rather do our home turf well than kind of spreading ourselves thin across the country. We have lots of accounts from here over to Halifax as well as to Vancouver and Vancouver Island. But our core and our interest is in Eastern and Southern Ontario as well as Southern Quebec.
So we've had Pure Labs Vitamins in Joanne's Place for several years now, and our listeners might be familiar with the magnesium glycinate, magnesium with melatonin, the magnesium with CoQ10 and taurine, which we're going to dive deep into later in this episode. But we're also going to be highlighting cardiovascular disease and cardiovascular health, specifically in relation to women, because this is a topic that is not talked about enough. And with February being Heart Health Month, we thought this was the perfect time to bring this knowledge onto our podcast. So, Cyrus, how about you give us a background about what cardiovascular disease is to start?
Well, there's a lot of very interesting facts around gender differences in heart disease, so I'll start with that. A bit of statistics here. Women develop heart disease on average 7 to 10 years later than men. But in general, both genders have a 1 in 3 fatal rate. So it affects both genders' final result equally. In generally, heart disease is the leading cause of death in women as well as in men. But there's a couple of very unique female factors that I want to bring up now. In general, to give you an idea, 5 times as many women die of heart disease compared to breast cancer. So that's
Wow.
huge. And women are also 16% more likely to die of a heart attack compared to men, because the initial symptoms of an impending heart attack are somewhat different than what people connect to this event in women versus men. And then in contrast to that, only 1/3 of all the research happening on cardiovascular disease focuses on women. So there is a very high incidence of this condition in men and women, but only 1/3 of the research really looks at women. Maybe I'll summarize the individual classes of diseases within this group. CVD, or cardiovascular disease, involve anything that has to do with sclerosis. And that's, in other terms, is plaque formation. If this plaque starts forming in the coronary arteries, which are the small blood vessels surrounding the heart muscle and supplying the heart muscle, then this can create angina, which is where you have this achiness in your chest because the heart muscle doesn't get sufficient blood and oxygen supply. And it can, in the long run, lead, if the plaque is further forming, leading to a blockage, then we're looking at a so-called myocardial infarction, which is what we call a heart attack. If plaque formation happens in the arteries leading up to the brain or into the brain, then we're looking at a more brain effect of plaque formation, and that's usually in the end result leading to a stroke, when a blood vessel completely blocks up and then the area of the brain right behind this blockage no longer gets oxygen and sugar and other nutrients, then this brain area will at some point cease to exist, and that is a stroke. And if plaque formation happens in the arteries of the periphery, then we're talking about generalized atherosclerosis. There's another subclass of heart conditions within the bigger umbrella of cardiovascular disease, and that is any kind of abnormal heartbeat, whether it's too slow, whether it's erratic, or too fast. We talk about arrhythmia as a subtype of cardiovascular disease. Then we have congenital heart diseases, which means they were present from birth, and they can sometimes be fixed surgically, sometimes can be treated, sometimes not. Then there's heart failure, where over time the heart output, the performance is slowly reducing to the point where the heart actually fails. And then there's also cardiomyopathy, which is where a specific condition where the heart muscle is affected and also slowly kind of reduces the output of the heart, and that can to some extent be treated with medications as well. So now I would like to loop back to a couple of gender-specific factors, and it's very clear to say that heart attacks strike differently for the two genders. Men, and that is what most people kind of connect to a heart attack, is they have this suffocating chest pain and pain radiating into the left arm. That is what most people quickly identify as heart attack. And women have much more subtle symptoms, and this is why women are 16% more likely to die from a starting heart attack, because the symptoms are oftentimes either ignored or misunderstood. Those symptoms in women are stomach pain, and they get oftentimes treated with antacids or PPI drugs, even though there's also shortness of breath and kind of a chest pain present, which is the same in both genders. But for women, this radiating pain kind of seems to go more up towards neck and sometimes even into the jaw. And since this is a symptom that you wouldn't directly connect to, oh, she has a heart attack, so you're not calling, or people around this person are not calling 911 because they're thinking, there's something funny going on, but what it is, we don't know. Nausea and lightheadedness is another very common symptom, and also sweating. And I mean, women that are at risk of cardiovascular disease at an age beyond 45 and up would very easily mistaken this symptom as just another hot flash, right? So it gets completely overlooked. And if that happens, then getting the help you need to get you through this crisis might get delayed or is not coming at all.
So, in terms of looking at your cardiovascular health, is there a specific age that you should start to prioritize this? So, to put into perspective, I'm almost 30, but I have always thought that cardiovascular disease was something that you looked at more, late 40s, 50s. But is this something that even as a young person, I should be prioritizing now?
I think as a young person, you would have warning signs that
Okay.
would help your doctor kind of pay attention towards potential cardiovascular conditions. Even though there's more and more people that are under a lot of stress, experiencing very vicious heart attacks at younger ages, and they were completely unprepared. It can happen
Right.
practically at all ages, but the likelihood is very slim.
Now, is it true that cardiovascular disease is hereditary?
Yes, many cardiac disorders can be inherited or they are run in the families, and that includes arrhythmias, obviously the congenital heart disease, but also cardiomyopathy, higher likelihood to develop high blood pressure. Those are all potentially running in families, but that doesn't mean you're doomed if there's a high incidence of any of these conditions in your family, because today we know that diet, lifestyle, and nutritional support can have a huge impact on these odds, and you can actually, with the right choices, beat your odds, and kind of work your way around this path.
Now, is there other diseases that can increase the risk of developing cardiovascular disease?
Absolutely, yes. The first one to name here is high blood pressure. I always explain it this way. If you have a closed pipe system, like in your house, and you double the pressure within that pipe system, your calcification in those pipes will also double up. And our cardiovascular system, especially the blood vessels, is a closed pipe system. And if you're running on a higher pressure than usual, you will have a higher incidence of plaque formation within that pipe system. Smoking is a huge risk factor. But also diabetes, especially if diabetes is not properly managed. If people have very high fluctuations in blood sugar levels. You can imagine that if your blood sugar levels are high, your blood turns more like into a ketchup kind of state. And if if that ketchup is then being pumped through the pipes, there's also a slightly higher incidence of plaque formation. And the final factor that I always call as a disease is inactivity. We have a saying in Germany, wer rastet, der rostet. In English, that means who rests will rust. If you don't
Wow.
engage the muscle pump and improve circulation and flush the pipes, you will have much higher likelihood to develop plaque than with adequate amounts of exercise.
Yes, so many people are so sedentary these days, whether you work a desk job or right now you're working from home, not as active, getting outside, and it contributes to so many different diseases.
Well, people say, okay, I have my exercise class scheduled every Friday afternoon. I am exercising, but that is truly not enough. Today we know exercise means daily. Yeah, and that doesn't mean you have to partake in organized sports every day of the week, but you have to find an activity that brings your heart rate up and engages the muscle pump adequately every day. Taking your pooch for a walk, strolling down sideway in a very relaxed fashion is not exercise. Now you gotta really go for a walk. And I highly recommend, especially for the elderly, to use these walking sticks, because then you're also engaging the muscle pump in your upper extremities and help flush through those tissues and through those pipes properly, which then also might have an impact on already developed osteoarthritis and various other things in those tissues. I also want to quickly, because it's truly an evening filling topic, talk about cholesterol. As a pharmacist, I've dispensed I don't know how many hundreds of Lipitor, Crestor, and the like. And for now, at least 15 years, there's a strong discussion about the value of these prescription drugs, and they're still today being prescribed in large amounts. I believe there's a discrepancy between benefit and risk. I believe that, yeah, cholesterol, especially if you have very high levels of the bad kind, the LDL, the sticky kind of cholesterol, is not a good thing. But within plaque formation in the cardiovascular system, the first thing that needs to happen for plaque to form is there has to be a spark of inflammation in those blood vessels. And that is clearly lifestyle induced. So people can live a long life with higher cholesterol levels if they can manage to keep their inflammatory tendencies under control. We're going to be talking about testing on those things in more towards the end.
So, on a professional standpoint, what would be some safe supplements that women could take to manage or prevent cardiovascular disease?
Well, there's a handful of things that I think have a therapeutic value. First one to mention is magnesium. There's lots of studies stating that magnesium deficiency contributes to pretty much all heart health problems we are facing in our world today. A little bit of a side story here is if you go to a hospital, to an emergency room with any kind of cardiovascular condition, the first thing you get is a shot of magnesium, usually IV. And the doctors just want to make sure there is enough magnesium in the blood to help muscles relax. Magnesium is our calming and relaxing mineral. It regulates our nervous system, helps with sleep, stress. It actually also prevents anxiety, nervousness, restlessness, and irritability, and also regulates our digestion. Another very important component here is L-glycine. It's an amino acid that can be used as a supplement by itself. It actually has shown anti-atherosclerotic properties and also anti-inflammatory effects. So by combining magnesium with the amino acid L-glycine, we get magnesium glycinate. And that is clearly, from my point of view, one of the most valuable kinds of magnesium. Also because when you bind a mineral to an organic amino acid, the bioavailability, which is the step of absorption from the gastrointestinal tract into the blood, is significantly enhanced over so-called organic acid salts like citrate, malate, or fumarate, and also versus magnesium oxide by itself. Amino acids help minerals enter into the bloodstream. So you get better bioavailability and you get synergistic effects from the magnesium together with the L-glycine. So putting those two together into one product, magnesium glycinate, is like a double feature, double whammy, providing synergies. 80%, and that's a number that comes from 2010. I dare to say today in 2021, the number is bigger than 80%, of the North American population is magnesium deficient. So that means if you're today starting out with a magnesium supplement for the first time, and you consider yourself to be deficient or on the verge of being depleted, if you just use regular so-called RDA level doses, you're just providing your daily requirements, which is not bad as a starting point. But in order to achieve true therapeutic turnarounds, you got to provide the RDA plus some extra to slowly replenish your deeper tissues, which is why individuals that start using magnesium for the first time should consider using a slightly higher dose per day in divided doses for just a couple of weeks to also replenish deeper tissues. And after that, you kind of find the maintenance dose, which usually resembles the RDA level or the label dose that is recommended on Canadian products. And that then allows you to maintain on a full tank rather than maintaining on an empty tank. For anybody dealing with or freshly diagnosed with a cardiovascular disease of any kind, I would recommend to use regular magnesium glycinate in this fashion, dosing high in the first couple of weeks and then kind of maintenance dose, and then switch to a product that we make. It's called MTQ, or magnesium taurine with CoQ10, which combines magnesium, taurine, and ubiquinol in one product and use that as your cardiovascular maintenance product. So you're using the pure form in high dose to achieve replenishment, to fill up your tank, and then switch over to the cardiovascular formulation, combining magnesium with taurine and CoQ10 / ubiquinol to then maintain and coast along in a replenished way. Just to explain that, taurine is another amino acid that has a strong impact on muscle. If you would dissect the body and look for taurine levels in the different tissues of the body, you would find highest concentrations in the heart muscle. So researchers were thinking, wow, what's taurine doing in the heart? What's its job there? And they were very quickly able to find out that taurine helps funnel magnesium and potassium deeper into the muscle cells. Magnesium is hugely important for muscle relaxation. Potassium, hugely important for cellular hydration and electric conductivity so that nerve impulses can be executed. And you can imagine the heart muscle is the hardest working muscle in our body. It runs 24/7 at a certain pace. Whenever you need more action, you get more action, and that's the way it's supposed to be. And all the way up to beats per minute of like 140, 50, 60, 70, and down to resting heartbeat of, on average, 50, 60, 70, depending on the individual. So, but it pumps every second of the day, and it needs its supplies. So allowing these minerals to reach deeper into the heart muscle cells is of huge benefit. Furthermore, taurine also is beneficial for insulin activity. It sensitizes insulin receptors, so you're kind of working towards better sugar metabolism. It is generally important for muscle health, not just the heart muscle. What's good for the heart muscle is just as good for any other muscle of the body. It helps with energy production. It's a calming amino acid, similar to L-glycine. Improves brain function and allows you to cope with stress better. So, well, that's all from one little amino acid. The third component in the MTQ is the CoQ10, and that's a natural fat-soluble antioxidant that we make ourselves in specific amounts. It's important to keep the bad cholesterol less sticky so that you're actually reducing the glue or the cement function of cholesterol. It is hugely important for energy production. It helps generate ATP, and also very interesting as an antioxidant. It reduces radicals and peroxides in our bloodstream, and this way protects the inner lining of the blood vessels. And you remember I talked about the whole controversy about cholesterol as a risk factor versus inflammation. If you manage to reduce radicals and peroxides with the use of antioxidants like CoQ10, but also vitamin C on the water-soluble front, you're reducing these sparks that cause inflammation that then later on lead to plaque formation. So CoQ10, especially the ubiquinol form, the active form, is hugely important here. And for those individuals that already use statin drugs, like Lipitor, Crestor, and the like, these medications work because they block a specific enzyme called HMG-CoA, and this enzyme produces cholesterol. But the same enzyme also produces ubiquinol. So by using the drug to block cholesterol production, you're also blocking your body's own production of CoQ10. So anybody, and a good pharmacist would tell you that if you're getting a new prescription for any of the statin drugs, to use at least a base amount of CoQ10 together with your statin drug to make sure that you're not depriving yourself of your own CoQ10 production for all its beneficial protective properties. So putting magnesium, glycinate, taurine, and ubiquinol into one formula from a cardiovascular point of view is a no-brainer. A dosage here is simple, 2 capsules twice a day. You take that with breakfast and dinner. And then some people love the magnesium glycinate at bedtime for its relaxing and sleep regulating and also bowel regulating properties. So they could take another 1 or 2 capsules of the regular glycinate at bedtime. The next on my list is zinc. So zinc is normally connected to immune support. People kind of think of zinc when they catch any flu that goes around, but it's also, there's direct connection between cardiovascular diseases and zinc deficiencies. In countless studies, this was documented. Zinc seems to reduce the risk of atherosclerosis, so plaque formation in the periphery, and has a protective effect against myocardial infarction, heart attacks, and also shows some effect on ischemia, which is this condition where the plaque in the coronary arteries has reduced the blood flow into the heart muscle. And ischemia is this, we call this window shopping disease, where you go 10, 15 steps and then you have to stop because your heart's ability to pump is not sufficient. There's clear connection or protective effects of zinc in coronary artery disease, cardiomyopathy, and you're catching practically, as we say in Germany, 2 flies with 1 swat, because by using adequate amounts of zinc, you're also improving your body's immune system. Zinc is hugely involved in the production of white blood cells, and those are the cells that actually detect and kill viruses. So keeping your zinc levels at proper levels is one way of trying to fight back a potential infection.
Are there any drug interactions that our listeners need to be mindful of before taking magnesium or zinc?
So drug interactions for minerals in general, magnesium really only interacts with a handful of antibiotics, the so-called fluoroquinolones like ciprofloxacin and levofloxacin, and usually you get a warning sticker on your prescription when you have an antibiotic script to not use it together with minerals like calcium and magnesium. Zinc interferes with thyroid medication, especially Synthroid or Eltroxin. Those are the 2 most commonly used thyroid hormones, and you would have to simply take zinc away from your regular thyroid dose by at least an hour, hour and a half. But again, that should normally come from a good pharmacist as well as a general recommendation.
That's good to know. What about vitamin D and vitamin K? Do they have an impact on reducing or managing cardiovascular disease as well?
When we talk about vitamin K, we have to distinguish between K1 and K2. K1, or phylloquinone, is the vitamin that is best known for its role in the so-called coagulation cascade, which helps the blood coagulate. And one specific blood thinner called coumadin or warfarin interferes with vitamin K1 metabolism. It's a very important medication for individuals at risk of developing heart attacks, strokes, any kind of plaque sclerosis, because by blocking the activity of K1 with the drug coumadin, you keep the blood thinner, there's less coagulation possible, you're kind of reducing the risk of blockages. But these drugs are to be adjusted very finely. Patients have to go to do blood work and test their INR level on a very regular basis until they find the stable dose that works perfect for them. And any fluctuation in K1 during this time might have severe side effects, meaning you might be bleeding or your coagulation, your blood thinning effect is not working sufficiently. So people need to stay on a very consistent diet of green leafy vegetables, not alter amounts too excessively any given day. And using a vitamin K1 supplement at the same time might also lead to fluctuations. So people shy away from vitamin K for the wrong reasons, because you can also adjust your coumadin or warfarin dose with daily intake of K1, and then you might have to use less warfarin to achieve the same goal. But you have to be very consistent then with your vitamin K supplementation. The other K subtype is K2, and it plays an essential role in how the body handles calcium. K2, and especially there's another group of molecules within the K2 group, and especially the so-called form MK7 is the one that gets the most attention here. It helps bring calcium to where it's supposed to go and prevent calcifications, especially in the soft tissues, including the cardiovascular system. And if you manage to bring the calcium where it's supposed to go, and with that have less calcifications in the soft tissues, your arteries stay much more flexible, and with that, much more healthy. So K2 MK7 is, from a cardiovascular point of view, a very powerful supplement. In contrast to vitamin D, which I will talk about next, you don't have to use excessive amounts. Just a daily supply of 120 micrograms is sufficient for most. And also, K2 MK7 does not really interfere with warfarin or Coumadin, even though physicians will always say, oh, be careful, be careful. But if you kind of decide to use a consistent dose of K2 MK7 on a daily basis and then adjust your warfarin levels accordingly, there's no risk, no fear. Also, more modern anticoagulants like Pradaxa, Xarelto, and Eliquis do not interfere with vitamin K, period. There's no need to worry about vitamin K supplementation at all while on those medications. So finally, vitamin D3. I'm personally a huge supporter of vitamin D3 optimization. I believe this really needs to become mainstream medicine, and I explain to you why. Health Canada today still recommends just 1,000 IUs of vitamin D3 per day for any North American, for any Canadian. And most of us do not develop adequate amounts of blood levels of vitamin D3 on that dose. Just to give you a bit of idea here, if we were to hunt and gather in loincloth, living close to the equator like our ancestors did, our body exposed to, our full body surface exposed to equatorial sunlight for 10, 12 hours a day would produce between 15 and 25,000 units of vitamin D3 per day. And here we live in Canada, and we expose the tip of our nose as surface area for about 5 months of the year to sunlight, and even that only for minutes per day. And we get the recommendation to use 1,000 units by Health Canada, and that's simply not right. As a health professional, I cannot stand or sit here and say everybody should take 10,000 units a day, because that's not right either, because vitamin D is a fat-soluble vitamin and it can accumulate in our bodies. What I'm supporting is vitamin D optimization, where we actually use blood tests of vitamin D3 to determine what dose do I have to take to reach a vitamin D3 blood level of 75 or slightly above. It's 75 millimoles per liter, or just the number 75 should help you gauge that. In order to do that, we might have to test not just once, but 2-3 times, and then adjust the dose accordingly. There's also a very nice video on our YouTube channel under Pure Lab Vitamins, where we explain the process of vitamin D optimization in detail. So you just punch in Pure Lab Vitamins into the YouTube search bar and look for vitamin D optimization video. So from a cardiovascular point of view, vitamin D3 is hugely important. It has received widespread attention in its role of preventing cardiovascular disease. And that means you shouldn't be starting vitamin D optimization at the age of 65. You got to start today to kind of find and get an understanding of what D doses you should take based on your average exposure to sunlight and your habits and lifestyle to stay in a proper range of vitamin D in your blood to prevent the development of cardiovascular disease. And that's the major goal, is to not even don't even get there, right? There's also clear evidence that proper vitamin D levels protect against the development of type 2 diabetes. That's a nice thing to avoid. No? And funny enough, stress is a vitamin D killer. During times of acute stress, our blood levels of vitamin D drop into nothing. They're practically not measurable anymore. And we all currently, and even before COVID-19, we all have stress up the wazoo. So there is really an important tool to improve your overall health by maintaining adequate K and adequate vitamin D3 levels. When it comes to drug interactions of vitamin D3, there's really nothing to mention. There's a couple of very old-style drugs that interfere to some extent. but they don't interfere in the efficacy of the drug. These drugs actually interfere with vitamin D, making it break down more quickly. So, and these are really very old drugs. To summarize, K and D. I'm not a fan of fixed combinations of vitamin D and K in any kind, because if you're actually aiming to optimize your vitamin D levels, you would most certainly end up taking too much vitamin K at the same time because of the fixed combination. And there is no need for large amounts of K2, especially not K2, MK7. There's really only a handful of conditions where naturopaths sometimes use higher doses per day. For the average individual, 120 micrograms per day is adequate. So there is no need to bring that up to 4, 5, 6, 700 micrograms in your attempt to use more vitamin D3. So I stay clear of combination products. We're actually launching a brand new K2 MK7 product next month. It's very unique vitamin K2 MK7. First of all, it's soy-free. Most K2 MK7 comes from fermented natto, which is a soy product, and there's lots of individuals not tolerating soy as well. And there's also big controversy about soy being exclusively gene modified, GMO. But the bigger feature here is in this dry powder form of K2 MK7, the active ingredient comes in a double micro encapsulated form. Vitamin K, as you can imagine, has a very high affinity towards calcium and other bivalent minerals like magnesium and zinc. So if the vitamin K2 MK7 would meet a calcium or magnesium in the gastrointestinal tract, it would right away bind, and this bonded K2 MK7 would no longer be absorbed. And that affects dietary calcium, magnesium, and zinc that comes with your food, like dairy products and nuts and seeds and the like, but also supplements. So by double micro encapsulating the K2 MK7, we're actually preventing this potential bond of K2 with any kind of mineral in the gastrointestinal tract. It gets absorbed into the blood, and like it's fully bioavailable to do its job of binding calcium in the bloodstream to bring it then to where it's supposed to go and prevent further calcifications within the cardiovascular system. So this product is hopefully coming out mid-February.
Awesome. Well, we're looking forward to it.
It's really good stuff. I'm super proud of it. Actually, the raw ingredient comes from Norway. I found it through a distributor in Germany, and I'm very pumped about this product coming into the Canadian market.
Amazing. So, aside from vitamin D levels, are there any other tests that our listeners should be advocating for with their medical doctors or naturopathic doctors in terms of looking at specifically cardiovascular health?
Yeah, there's a few things. First of all, I wish we all could go to a pipe cleaning service starting at the age of 35. Every 10 years, you go for another, like a duct cleaning service, you go to your internal pipe cleaning service. That doesn't exist to this day. It will maybe one day, using vitamin K doing all the dietary and lifestyle measures is practically replacing this kind of wish, and we got to work towards that. And also, please don't think you all have to be perfect tomorrow after hearing this for the first time. This really is a process, a learning process. Nobody expects anybody to have a perfect diet and a perfect lifestyle by tomorrow afternoon. It really is, you got to read, you got to learn, you got to take responsibility for your own health. And with more learning comes more knowledge. And with that, your choices will become better over time. It's a process. So when it comes to other tests that can be considered, I always distinguish between mainstream medicine and naturopathic medicine. Mainstream should look for CRP levels. CRP stands for C-reactive protein, which is a blood marker that is directly connected to inflammatory tendencies. So we discussed before that inflammation within the cardiovascular system is the starting point for any kind of plaque formation. So a higher CRP level is directly associated with a higher risk of heart attacks, strokes, or generalized cardiovascular disease. And that would then give you a flag to say, okay, you got to start changing things now with diet, lifestyle, and maybe with some supplements to slowly reduce your level of CRP. And you could remeasure in 6 months or a year. I prefer quicker retests, especially after starting to make changes, which would also then motivate you to be more compliant. When you see success, that you were able to cut your CRP level in half, no, you're much more likely to continue on this path of new diet, new lifestyle, and so forth. So that's hugely valuable. There's also another blood work called BNP, which stands for brain natriuretic peptide, and it's kind of a late stage test. When your heart is damaged, the body secretes this peptide into the blood, and it has a function to ease the strain on the heart muscle. So it technically is a signal that the tissues can send out to redirect blood flow and put less workload onto the heart. So technically this BNP marker is a marker of damage, and that should not be existent. Then you can also, quite interestingly, if there is any kind of consideration that for example, your CRP level is very high, the doctor could ask for an MRI, not to look for plaques or blockages, but to look for inflammation. MRIs are actually able to detect in the soft tissues cores of inflammation. And you could then, again, also use this initial MRI as a gauge, as a benchmark, with diet, lifestyle, supplemental, potentially prescription drug usage, to then reduce the level of inflammation in those specific areas of the heart or the periphery. Naturopathic medicine is vast, and there's lots of therapy forms available. Depending on who you consult with, you get recommendations. From my point of view, there's really one very easy test that can be done at home, and that's to test your pH, your acid level in your system. We use pH test strips to measure your average pH in saliva or urine. Keyword here is average. If you take one test right now, this is really just one snapshot of your full-on 24-hour rhythm of systemic pH, and it's practically useless. In order to get a true, meaningful test result, you have to test 3-4 times a day for at least 4 or 5 days in a row, and then calculate the average pH. And if that pH is in the more acidic range, you have some work to do. Diet, lifestyle, and stress significantly enhance acidity in our bodies. And the body has only a couple of, actually 3 or 4 mechanisms to handle systemic acidity. In general, acidity inside our bodies is corrosive. It fuels inflammation. You can imagine if you have a corrosive substance working on the inside of the lining of the cardiovascular system, then that triggers more inflammation as well. And again, you have a starting point for plaque formation. So managing and balancing your body pH is hugely important for cardiovascular health. On top of that, any kind of pathogenic bacterium, fungi, virus, and also cancer cells thrive in an acidic environment, while our enzymes and our immune system thrives in a more alkaline state. So by continuing to be more acidic than you should be, you're promoting disease while you're suppressing your body's healing abilities significantly. Also, any kind of waste that we produce, our metabolic waste, usually in form of organic acids, is more soluble, water soluble, in an alkaline range or milieu compared to an acidic range. And that means that our own waste can be excreted more effectively if our body is on average more alkaline. So alkaline therapy, becoming more alkaline, is actually a natural form of detox. And we have a product that's actually the second product I ever made, and it's the second one with which we started Pure Lab Vitamins. It's called Alka Pure pH. It's the very potent alkalining formula. It's calcium-free. No surprise here, because you don't want to pump, and many other of my competitors in the alkaline therapy range They use calcium carbonate as the active ingredient, it's the wrong way. You gotta be calcium free and also sodium potassium balanced. Again, this is an evening filling presentation here. Alkaline therapy, I'm sure we're gonna have a webinar on this at some point this year. So alkaline pH together with diet, lifestyle, exercise can help you cleanse your system, get rid of built up acidic waste, make your enzymes work better, make your immune system work better, and reduce potential calcium plaque. Overall, it just gets better and better with if you manage to stay more alkaline. Yeah, that's that from my point of view when it comes to potential testing from a naturopathic point of view.
Thank you so much for summarizing those tests for our listeners, Cyrus. I feel like there's a lot of disconnect between once you get your blood work tested and when the results come in terms of reading those results, because a lot of the times they're sent electronically. So unless there's something being flagged, you don't always actually see or learn about what those results tests are unless you're really advocating for that with your doctor or naturopath. So thank you for summarizing that, along with all the other information that you shared in this episode. So many great tidbits of information when it comes to supplements and understanding cardiovascular disease, and also the signs and symptoms of what cardiovascular disease can look like, specifically a heart attack for women. It's scary to know it can be missed in terms of diagnosis because the symptoms are so similar to other health issues. So I'm thinking about the women that I see on a regular basis right now at work, my clients, my family, and really I hope that this podcast episode is inspiring you to prioritize your cardiovascular health and continuously keeping up to date with those test results as well too. So is there any last bit of information that you can give to our listeners in terms of their everyday lifestyle when supporting cardiovascular disease?
I want to emphasize again, nobody is perfect and nobody expects you to be perfect tomorrow. It's really and I know that information out there on health is weighing you down because it comes from all angles and from all things. But there's really no way around starting to read, talking to people, and kind of drawing the essence out of what you kind of can learn and apply your own common sense to things, and don't follow every fad that goes around. We have seen lately with the ups and downs of very hip diets, that we actually experienced a complete turnaround even in mainstream medicine away from carbohydrates, whole wheat, whole grain products, towards more low carb diets being that much more beneficial for us. And even that in itself, it's a strong recommendation. But nobody expects you to be perfect there either. But if you can slowly kind of make the right decisions towards lower levels of carbohydrates and at the same time replace that with clean, healthy, local, organic vegetables and crops, you're on the right track. And try to implement things step by step instead of expecting from yourself to be done by tomorrow, right? Because you won't.
Yes, I second all of those comments. Don't rush your wellness journey. Don't rush your healing process because there's so many pivotal points that can come up that can completely change the direction that you're going in. And those are things you can't foresee, but you just have to learn to adapt and adjust to. Additionally, keep in mind that sometimes it takes a team to help you along your journey. So to really navigate through all of that information and to help you find the right products and the right lifestyle and the right diet that's suitable for you, use the resources that are available to you, whether it's your doctor, a naturopath, a nutritionist, reaching out to a supplement company directly, or coming into Joanne's place and talking to the educated staff there who can really help to support you to make an impact on your wellness journey. So don't think that a small action is just a small action, because anything that you are doing right now that's supporting your wellness journey is a step in the right direction. And lastly, Cyrus, if you could give our listeners a quick rundown on the event that you guys are hosting on Wednesday, February 17th.
We have a webinar coming up called The Heartbreaker. It's specifically on the same issue. If you wanted to kind of listen to this again in a bit more detail with slides and a bit more pronounced side stories in this online webinar. So look out for the registry link on Facebook, Instagram, and email for that.
Fantastic. Yes, we will definitely share that across our social media platforms. So stay tuned for that and sign yourself up.
Okay, thank you for having me.
And that wraps up today's episode. Thank you so much, Cyrus and Pure Labs Vitamins, for supporting our community and educating them on why they need to prioritize their cardiovascular health. Thank you guys so much for tuning in and prioritizing your wellness journey with us. You know what to do. Subscribe to our channel, share on social media that you're listening to the Wellness on Purpose podcast, and stay tuned for the next episode.